The Texas Medical Center is internationally recognized. It's known for its healing, education, and groundbreaking research. People travel here for medical care from all over the country, yet the U.S. is the worst among industrialized nations in preventing deaths. As far as overall medical care, the state of Texas falls right in the middle, with care as expected. The states with top medical care are yellow, the bottom performers red.
The Texas Medical Center actually is leading the advances in healthcare, both with regard to education and research for the country. So it's not just for Houston.
You'll find 10,000 doctors in the Texas Medical Center within 46 institutions, and it's on the rise. That's because of Houston's growing population as well as aging baby boomers. One doctor refers to boomers as an age quake because medically it's the equivalent of a massive earthquake.
The first baby boomers are crossing the age of 65 and entering that age where they need, more medical care and more medical services.
We met up with Dr. Spencer Bertelson at Kelsey-Seybold Clinic, one of the first healthcare facilities in Houston. Dr. Bertelson says Kelsey-Seybold is doing its part to help prevent another major problem that plagues all healthcare: medical mistakes. Their goal, along with other local hospitals, is to turn all handwritten notes into computerized files.
Electronic medical records and electronic prescribing, which can have embedded medical intelligence that prevents errors from being made.
It's an important goal because Medicare data shows more than 200,000 people die every year in the U.S. from preventable medical mistakes. Another big concern is lack of health insurance. 44 million people across the U.S. are uninsured, but it's Texas leading the nation with the highest number of uninsured residents.
In Harris County, we have 30% of our population is uninsured, and that's higher than it is in Texas in general, which is about 24%. And that's quite a bit higher than the country, which is 15%.
And it doesn't appear to be lack of funds. The Dallas Business Journal reports 72% of Texans without insurance have at least one family member working full-time. And 40% of uninsured families make at least $40,000 every year.
The uninsured problem is a severe problem, and it's growing. In fact, it's starting to affect even patients that have insurance, in that uninsured patients come into the emergency room and they make it more difficult for everybody to get care because they're waiting to the last minute because they can't afford normal care.
To sum up our state of health care,
I think the two words that would describe it is excellence in care, but also very expensive to the point of becoming unaffordable for many of our citizens. And so what we need to do is to really focus on value, which is the ratio of quality to cost. We need to keep the quality as high as we can, but moderate the cost.
Tomorrow night at 9, we'll introduce you to an ever-growing trend in healthcare. A local man travels all the way to India to get life-saving surgery because he didn't have health insurance and it was just too expensive here.